Hello, my name is Shadi Amini, and I'm a journalist with NPR, the public radio network of the United States. Today, I will be interviewing Emily, Jillian, and Bella, public health experts from the National Opioid Action Coalition, on the health topic of the opioid epidemic. Doctors will soon have new guidelines for the Center for Disease Control and Prevention on how and when to prescribe opioids for pain. As experts on this issue, what are your opinions on this and how does it compare to the 2016 guidelines? The first question I'll be asking is, what do these new guidelines mean for Americans?
So these new guidelines, which are currently under review as a draft, they will serve as an update to the agency's previous advice on opioids, which was originally issued in 2016. And the advice is widely blamed for leading to harmful consequences for patients with chronic pain. Federal officials have acknowledged their original guidance was often misapplied. It was supposed to serve as a roadmap for clinicians navigating tricky decisions around opioids and pain, not as a rigid set of rules. The new proposed guidelines continue to advise against using opioids for pain when possible and to take a cautious approach when it's necessary, given the risks of opioid misuse and overdose. So the new guidelines also emphasize that clinicians should use their own judgment in deciding what will be safe and an effective dose for each patient as well.
Thank you, Bella. My next question is, how do these guidelines compare to the 2016 guidelines?
One of the most important differences is that the newer guidelines are no longer going to put a limit on the dose and duration of opioid prescriptions. Under these new guidelines, clinicians are going to be able to use their own judgment to decide what a safe and effective dose is going to be for their patients. One of the biggest problems we found with the 2016 guidelines was that they were being applied to situations that they should not have been applied to, such as for cancer patients. The new guidelines are going to be more specific and are actually trying to steer doctors away from using opioids as their first resort for treating pain, which we think will hopefully slow down the rates of opioid addiction in our country.
Thank you. That sounds great. My next question is, when you look at the current state of the opioid crisis, do these changes give you hope?
So yeah, these changes do give us some hope. However, opioids are still highly addictive, and although an individual's personal history and the length of time using opioids plays a role, it is impossible to predict who is vulnerable to eventual dependence on and abuse of these drugs. Legal or illegal, stolen or shared, these drugs are responsible for the majority of overdose deaths in the US today. We are glad to see steps towards change being taken, and we believe the best route would be, rather than softening its guidance, the CDC should issue two different sets of recommendations. One for those starting opioids and the other for those already on opioids. This would elicit the most positive change.
Thank you, Jillian. So my next question is, what are some of the potential public health harms that may result from the new guidelines?
Yeah, so some of the potential public health harms that may result from these new guidelines are patients who actually need these pain prescribed pills to manage a disease that they already have. They aren't able to access the prescribed opioids that they once were available to them because doctors don't feel as comfortable as they once did prescribing opioids to these patients ever since the new guidelines were made. So additionally, patients without a primary care physician found that almost no doctor would prescribe opioids to new patients. And in a recent study by the National Library of Medicine, we saw opioid prescriptions decrease from 37.76% to 13.29% over the study period. So that was a drastic decrease in the number of opioid prescriptions that were being prescribed.
Thank you, Bella. That's great to know. My final question is, how do medical experts, in contrast to policymakers, feel about the new guidelines?
So the new guidelines are a result of a collaboration between medical experts such as doctors, clinicians, and health leaders working with policymakers to produce these guidelines. The CDC's main takeaway from medical experts' recommendations is that changes are really an effort to ameliorate how the previous guidelines were misapplied without losing track of the fact that these medicines were vastly overused and oversold for a period of decades.
Okay, thank you so much for taking the time to do this interview. I have gained a lot of new knowledge about this epidemic that is overrunning the country and what is being done to help the opioid addiction. Thank you.
I thank you.